Hi, I'm sitting here with my friend and colleague, Dr. Arthur Krigsman, who brings us some very, very exciting news from the world of pediatric gastroenterology. Arthur, welcome to the show.
Thank you, Andy.
You've published previously in the area of inflammatory bowel disease in children with autism. In a nutshell, what were the findings of that paper?
Well, in the initial paper published in early 2010, what we were able to show was that children with autism who had long-standing gastrointestinal symptoms like diarrhea or constipation or abdominal pain or growth failure, when those children underwent colonoscopy, the biopsies showed inflammation. So that these children were not just having a bad day, they weren't children with nervous stomachs, but rather they had a real organic disease that related to the symptoms that the parents were complaining about.
Now that was wonderful news in a way because what it led to was the potential for new treatments. If you'd found nothing, there was nothing to treat. You found something, then there was something that you could do to help those children.
That's a critical point because the point of demonstrating that there was inflammation on the biopsies was so that you could then justify treating them. If you find inflammation and you have symptoms present, then it makes sense to try giving this patient an anti-inflammatory drug and seeing if it helped their symptoms. And that has been our experience.
And clearly that approach has worked for many, many children, so that's great news. But now, really exciting news. You've taken it to a whole new level, using the most sophisticated technology available to do what?
We subjected the biopsies, these inflamed intestinal biopsies of autistic children, we subjected them to high-tech analysis. Using that technique of microarray analysis, which studies the molecular components that are produced by the inflammatory cells. We are now looking for the products, the molecular products of those cells, and the molecular products of those cells have distinct signatures.
So the genes that are switched on and the genes that are switched off, effectively.
Correct. Not so much that it's a genetic disease.
And that's a very important point to make, isn't it? That a lot of money has gone into pure genetic research. That is not what this is.
Right.
This is saying, these are the genes that are part of the disease. These are the ones that are switched on. These are the ones that may be helping to drive the disease process. And these are the ones that are turned off. And they may be protective, for example.
Yeah, so this paper should not be interpreted as meaning that autism is genetic.
So tell me a little bit about the groups that you looked at.
We had a study group of children with autism who had chronic gastrointestinal symptoms, who underwent clinically indicated ileocolonoscopy and were found by the pathologist to have this nonspecific inflammatory presence in their ileum and or their colon. We compared this group to non-autistic children who underwent colonoscopy and ultimately were not found to have any diagnosis. The second control group was non-autistic children who had Crohn's disease, confirmed on their biopsy. And the third control group was non-autistic children who were found to have ulcerative colitis.
So in other words, is there an inflammatory bowel disease in these children? Number one. And number two, is it different from the signatures in known inflammatory bowel disease such as Crohn's and colitis? Is that fair?
Yes.
Right. A novel disease.
A novel disease. Either a novel disease or a emerging disease, perhaps.
So an early stage, for example, of, say, Crohn's disease.
Yes, exactly.
Right. What did you find?
Using microarray technology, what we found was the molecular products of the inflammatory cells in the autistic kids was not normal. The normal patients, when you took those bowel biopsies and you took a look at the variety of different molecules that were produced by those cells on the biopsy, they clustered in one area. When you took the biopsies of the autistic children with GI symptoms and inflammation on biopsy, they clustered in a second area. And when you took the bowel biopsies of the non-autistic Crohn's and colitis patients, they tended to cluster in the third area, so overlapping each other. What's very interesting was that although the autistic children's biopsies clustered in their own region, there was significant overlap with the Crohn's and ulcerative colitis, but virtually no overlap at all with the normal, non-inflamed, non-autistic children.
Now tell me, did you look at different areas of the bowel, or were you looking at just one area?
We were looking at both ileum, terminal ileum, and the colon.
And you found similar findings?
And we found, yes, we found that the colon biopsies that were inflamed were just as dissimilar to normal tissue as the inflamed ileum biopsies were to normal ileal tissue.
So what this is telling us is that there is a large number of genes that are behaving differently, that is, switched on or switched off, in children with autism compared with these other control groups.
So fascinating findings. I mean, here we are some 15 years on from the original work and confirmed beyond doubt that there's an inflammatory disease that may have unique characteristics in these children with autism.
The pediatric GI team at Wake Forest was exceptionally helpful. That's what really enabled us to provide data that is very, very meaningful.
Well, they must feel immensely reassured by that. Open-minded gastroenterologists who went into this, provided the samples you needed to test the hypothesis, and now a very, very important publication coming out of it.
Correct. And the parents, of course, the parents of these children who've always been saying this for so long, they feel very gratified at, again, their observations being validated.
So they've been saying this for years, and they were absolutely right.
Yeah. The issue of bowel disease, of inflammatory bowel disease, got so caught up with political issues, public health issues, and controversies, financial issues, that it poisoned that whole concept. The idea that there might be an inflammatory bowel disease that's unique to these children was tossed aside, primarily by people of the media. And that influenced the desire of scientists to pursue this avenue of thought.
So Arthur, in summary, fascinating new findings, confirmation that there's a bowel disease in children with autism with gastrointestinal symptoms, and that it has all the appearances of being either new or a precursor of something like Crohn's disease or ulcerative colitis.
Right.
Now, the very best of luck. Great job.
Thanks.